Welcome everyone to our launch webinar introducing the Community Rehabilitation Research Network, hosted by NIHR. I am Dr. Jackie McRae. I'm one of the founding members of the NIHR-supported Community Rehabilitation Research Network, or CRRN. I'm delighted to introduce today's speakers, Professor Lindsay Bairn and Professor Fiona Jones, our steering group members of the CRRN, and Dr. Sarah Roberts-Lewis, our hub manager. We're also joined by Humaira Abbas, who's the Senior Programme Manager at the NIHR, who supports the Incubator hubs. And it's my great pleasure to also welcome Professor Wilson Malaya to the panel. Wilson is Professor of Social Work at Kingston University, and he's recently joined Lindsay, Fiona, and myself on the steering group as we acknowledge the importance of social care in the community setting. I'm now handing over to Lindsay.
Thank you very much, Jackie. My name's Lindsay Bairn and I'm Professor of Physiotherapy and Rehabilitation at City St George's. And as Jackie said, I'm the lead and one of the founding members of the CRRN. In the next 35 minutes or so, we're delighted to be able to introduce you to the CRRN and share with you how we've worked with our members to identify their needs and priorities, and also started to think about ways that we can support them to increase research capacity within community trusts and organisations. We'll also let you know how you can get involved with the CRRN, and then finally update you on NIHR funding opportunities. Next slide, please. Hi there. Could we have the next slide? Thank you. That's great. So the CRRN is a new virtual national UK network based at City St George's, and it's funded for 3 years by the NIHR as part of one of their infrastructure awards. The Incubator Award scheme aims to identify areas that are underrepresented in research and then bring people together to try and think about the barriers to research and suggest ways to implement solutions to increase research capacity in a kind of long-term, sustainable, meaningful way. All the incubators are quite diverse, and so the way that they work and are run is unique to each area. And you can find out about other incubators by looking on the NIHR website, as there may be others that are also of interest to you. Next slide, please. So the CRRN Incubator was funded with a real focus on community rehabilitation research. Despite community rehabilitation being a really important area of health and social care, historically it's underrepresented in research and underfunded. So we aimed to really focus on how we can build capacity in this area. And the aims of our network include identifying and bringing together a diverse range of practitioners, researchers, and research managers in a community network. This involves practitioners aspiring to become involved in research, as well as those who may have already been more established in their research career, and those involved in research management and delivery. So it's a really inclusive network. Secondly, we aim to work with our members to identify and understand some of the barriers to research, and then co-design an inclusive national community of practice and resources to support community rehabilitation research. And then finally, we aim to become a central hub for research opportunity for people interested in community rehabilitation research. And ultimately, we aim to build research capacity and capability within this much needed field. Next slide, please. So the funding for our network is for 3 years, and it supports Sarah, our hub manager, and also provides funding for engagement activities each year. We're also able to bid for further funding for specific activities and projects. And this year we were awarded additional funding to deliver workshops about research to trusts and organisations within community rehabilitation. And Sarah will talk more about these later on in this webinar. Next slide, please. And thank you. So I'd like to talk through our network now. Our network aims to be inclusive. We welcome practitioners of any discipline working in health and social care, anybody involved in research management and delivery. We're keen to help people who have no experience, people who may have just dipped their toe into the research water, as well as those who are more experienced. Next slide, please. We started in January 2024, and the network is structured so we can really respond to members' needs. The leadership team is supported by a diverse, multidisciplinary steering group that helps with yearly objective setting and funding decisions. And a key feature of the CRRN is that once someone has joined as a member, they can then become involved in hub activities as a collaborator and have a direct influence on how the network is shaped. So stakeholders can be involved in co-designing, identifying and organising the hub activities. Champions volunteer to promote the CRRN and our activities within their local communities. And mentors are available to informally support and guide budding researchers by providing early conversations and kind of pointers of next steps. Next slide, please. So we're very conscious that community rehabilitation research needs to engage people from a variety of settings, and so cross-boundary working is key. So we're starting to work with other groups and communities that share similar interests and ambitions, including other hubs. Next slide, please. One of the organisations that we've already linked with is the Community Rehabilitation Alliance, which we're showing on this slide. And this helps us and our members connect with over 60 national charities and professional bodies across health and social care. And you can see the wide range of organisations that are involved in this alliance. So I'm now going to hand over to Fiona, who's going to introduce herself and talk you through some of the co-design activities that we've been completing. Thank you very much, Fiona.
Thank you very much, Lindsay. Thank you to everybody that's been able to join us today. If you could do the next slide, please, Petra. Thank you. I'm Professor Fiona Jones, and I'm Professor of Rehabilitation Research based at City St George's, and I'm one of the founding members along with Jackie and Lindsay. And I'm going to tell you a little bit more about Objective 2 of the Hub, which was to try as much as possible to carry out some really authentic co-design activities to really get to the heart of what people working in community rehabilitation want and need. If you can go to the next slide, please. Okay, so the objective was to design a community of practice. And I think at first we needed to decide what our community of practice would look like. We wanted it to be as wide and inclusive as possible, but we also wanted to know what the specific challenges are for members and what might be the facilitators as well for people that have managed to get their research up and running in community settings and keep it going. Through that, we identified the priorities, which are really critical. So what's going to be the ways that we can share knowledge, that we can really build engagement, and as Lindsay said, really build capacity in community rehabilitation research. And above all, we wanted resources that, as I said, people really want and need. Not more of the same, but something that is creative and focused on the areas that people really feel they need the support. If you can go to the next slide, please. So this just gives an overview of the staged approach that we went through. And you can see that we've held 3 co-design meetings, but in between that, we've actually done an awful lot to engage with members, to share the outputs of these co-design meetings through surveys, through gaining lots of feedback, because we have a very wide steering group, but not everybody was able to attend the co-design meetings. So the approach that we took to co-design was to go wide to begin with. So identify people's stories of research, the needs, the benefits, the barriers that they had experienced. And then from that process to start to narrow down and develop a real wish list of engagement activities that people will need. And I'll explain a little bit more about that shortly. And then finally, because we actually have a timeline that we want to deliver these activities. We had to do some prioritisation. And we did an awful lot of voting and surveying and work with our co-design meetings and our groups to really decide on the 3 main areas that we were going to focus on, and essentially build a to-do list for the hub. And just to explain that word cloud on the right-hand side, when we look at the areas that are upmost in people's minds, you can see clinical is the biggest word. So that the biggest issue for our members was how they can build their research activities within what is often a very busy clinical setting. Next slide, please. And if you could just bring up the graphic, please, on this slide. And this just focuses us on the areas of engagement that we hope to reflect in this work. We know that co-design is not about doing things for people, it's actually with, and we hope that we've really reflected this process. So we are up at, this is Arnstein's ladder of engagement, and we are right at the top end, which is about co-producing the outputs from our group, designing how people want it to look, how to engage with it, and involves multiple lived experience from our stakeholders. And it really brings both the experience and the expertise together. If you go to the next slide, please. So important part about doing co-design is about sharing narratives, sharing stories, hearing from real experiences. And I reached out to some of the members and asked them some questions. And I'm very grateful to 3 of our contributors that you're going to hear from. The first one is Rebecca. And Rebecca is just at the start of her research journey. In fact, I know today she's doing some work on her PPI with her PPI group and learning about co-design. And she's going to tell you a little bit about her story of getting into research. If you could just press the film to start, please.
I'm Rebecca McLaughlin. I'm a physiotherapist and I'm in the first year of my NIHR doctoral clinical academic fellowship. During my PhD, I'll co-design and feasibility test a pain self-management intervention for adults who live with sickle cell disease. As someone who's quite early in their research career, something that I've found really invaluable so far has been the opportunity to connect with other researchers and clinical academics and to share knowledge, insights and support. I think the Community Rehab Research Hub is going to be a really fantastic resource for me and other early career researchers like me who are trying to build their networks and connect with other researchers. As a clinician embarking on a clinical academic career, I'm also delighted that the Hub's going to provide resources to clinicians and to clinical managers to promote research within clinical teams. I'm really looking forward to being part of this community.
If you could do the next slide, please. So now we're going to hear from Geeta Ramthari, and Geeta is a consultant allied health professional. She works at UCL, UCLH, and she is an experienced researcher. And what she told us was how important it was to build research capacity in community. Although she's based in a hospital, what she needs to do is to connect with community teams so they can take part in her research and build their research skills. So we're going to just hear something from Geeta.
One of the challenges I've had is that neuromuscular diseases are rare, and a lot of the rehabilitation interventions that me and my group have been involved in developing are ideally actually administered and in the community, people to be supported there to then live well with their condition, bringing on some of these ideas through the interventions. But of course, I'm based in a specialist service in a hub, and actually, one thing that would be fantastic if the CRRN was able to facilitate networks for people like me who works in a particular niche area, with colleagues who are doing research in community rehab, but also community health professionals as well, to really help guide how interventions such as ours are best implemented in the community. So it would be great if the CRRN was able to support with that kind of networking and information and knowledge exchange. And I'm looking forward to see what they do next. Thank you.
Thank you. If you could just go on to the next slide. So the final area that I would like to share with you is what came up through our co-design activities was how important it was to hear from rehabilitation team managers that actually help their staff get into research. I'm grateful to Rachel, that is the clinical lead for a community neurorehabilitation team, who has a long established practice of supporting her staff to take part in research. If you could just play that audio, please.
Sometimes it's the smallest and simplest thing that can make the biggest difference in whether a project can get off the ground or not. One of many challenges in community rehabilitation research is that community services are often staffed to bare minimum, so there is limited time for clinical work, let alone supporting research. As a network dedicated to community rehabilitation research, I'm really hoping that the CRRN will be able to support me and others to champion the prioritisation of research in a community rehab setting, to encourage commissioners to incorporate this into the planning for and the staffing of community services, and to empower therapists and wider AHPs to start their journey into clinical research. Much of what we do in community rehabilitation lacks a robust evidence base underpinned by research. And this is going to be crucial in an increasingly stretched health and social care economy.
Thank you. And there was just the audio for that piece there. If we can go to the next slide, please. So just to sum up what we're thinking about here. So the three areas are around the linking and the mapping, and that was illustrated both from Rebecca and Geeta's experience. And the idea of a dating website was what our group thought about, where a clinician working in the community could register their interest in taking part in research and maybe could connect with an academic that's either doing research in this area or can highlight ways that they can start to do their research. So the third area is this idea of pulling together the opportunities that exist. And part of it is being able to navigate them easily as somebody that's working in clinical settings that has very little time. And we hope that the hub will be able to do that. So the strategic linking and mapping is critical. But I think what area came up for us, which was we hadn't necessarily thought about, was actually creating guides and support for managers to help support their staff to get started in research. So I believe that's my bit finished now, and I'm going to hand over to Sarah to tell you a little bit more about how you can be involved with the CRRN.
Thanks, Fiona. If we could have the next slide, please. So my name is Sarah Roberts-Lewis. I'm the manager of the Community Rehabilitation Research Network, and I am a clinical academic myself with a background in physiotherapy. Next slide, please. So I'm going to cover the third main CRRN objective to support research opportunities for all, and we really are trying to be inclusive of anyone who has community-based rehabilitation research interests, whether your background is social care, whether your background is from a clinical profession, if you work in the private sector, voluntary sector, charities, service users, carers. We really invite everybody to get involved. If we can have the next slide, please. So we've compiled some resources to help support people who want to get research active. So this is our website, and on our website, you can find advice about getting started in research, how to get connected and start building your research team. We also have career development resources on there, and there's some advice about where to go for funding. This website is a starting point, and we will be developing it further over the coming years, according to the needs of our network. And you can see the website link in the chat. So next slide, please. So you can get in touch with us in a number of ways, and we'll put the links in the chat for you. But first of all, you could drop us an email. We're at communityrehab@sgul.ac.uk, or please follow us on social media. We're currently on LinkedIn and X, that was previously Twitter. We also send out a newsletter, so please do join our mailing list. It's always only a one-page newsletter, just once a month, and we just highlight really carefully selected opportunities and events. This newsletter is really guaranteed not to overload busy community practitioners and researchers, because we know that time is often short. Next slide, please. So you can get more involved with the CRRN in several different ways. You could join us as a collaborator. As Lindsay mentioned earlier, we welcome stakeholders, mentors and champions from all backgrounds and all communities. The link to sign up should already be in the chat. It's the same one as for joining the network. Another way to get involved is to have a CRRN workshop in your community. Next slide, please. So we're delivering short rehabilitation research workshops to communities, groups, trusts across the UK in the coming months. And the workshops were co-designed with our members, for our members. The workshop modules, as you can see from this slide, range from making a case for the benefits of research engagement for different organisations, ways to get started, thinking about making a research proposal, how to get connected, thinking about research proficiencies and frameworks, obviously funding. And in reference to the co-design priorities that Fiona was talking about, let me also highlight the support for managers module at the bottom in green. And obviously those kind of themes from the co-design are actually sort of woven into all the different modules. Within the workshops, we usually present 3 modules depending on what each community really needs. And we also feature interactive activities, for example, discussions to identify local research barriers and facilitators, and exploring ways to overcome local challenges through interactive discussion, case study examples. And then we can pull together outputs from the workshops that can be shared to help health and social care practitioners to move rehabilitation research forwards within their own community infrastructure, because we recognise that all communities are organised slightly differently. So we do tailor the workshops to specific community needs. Please get in touch with me if you'd like to organise one in your community. The email address to get in touch is in the chat. Can we have the next slide, please? Okay, so finally, another way to get involved with the CRRN is our new online community of practice map. The link to our prototype website, researchmap.uk, will be added into the chat there for you. Next slide, please. So researchmap.uk is a CRRN co-designed UK community research directory. And the website is support for linking and mapping the community research rehabilitation landscape. Currently, the website is in a prototype phase. You can add yourself, you can add your organisation and any projects to the simple directory currently. And then when you look at the directory, you can filter according to research interests. And you can add any projects in the community. Yes, it could be research that you've done recently, you know, a big clinical trial or something that you've had published, but it could also be other types of projects, PPI groups and special interest groups. You could be looking at quality improvement type projects as well, things that you think that would be useful to share and that you also want to get out there so that people know what you're doing. Following on from this prototype, there'll be several phases of development, and that'll be done in response to user feedback and obviously the needs of our members. We have really exciting plans still to come. One example is our database of CRRN mentors who will be getting listed onto the research map soon, and there's lots more ideas. So watch this space. And in general, we have lots more exciting innovations to come from the CRRN in support of health and social care practitioners research in the community. So I'm going to hand over now to Humera to talk about NIHR funding. So next slide, please.
Hi everyone, it's great to be here. My name's Humera Abbas and I'm a senior program manager based in one of the programs teams at the NIHR Academy, and I also provide support to the Community Rehabilitation Research Network. I'm here to give you a quick overview of what we do and the programs and awards that are offered through the Academy. Next slide, please. I just want to start by giving you some quick background. The NIHR's mission is to improve the health and wealth of the nation through research. And as a senior program manager at the NIHR Academy, I work within one of the teams that manage our research training awards and programs. And in a nutshell, through our offer, we aim to build research capacity by attracting, training, and supporting the next generation of health and care researchers to address and find the solution for emerging health and care problems. Next slide, please. So I'll just give you a quick overview of the NIHR offer in terms of the schemes that we have to support career development and research training. Next slide, please. As you can see here, we have a range of schemes looking to provide career development opportunities for different career stages and professional backgrounds. At the NIHR Academy, we've been working hard to simplify our offer, and I'll go into this in a bit more detail in the next couple of slides. Next slide, please. We also have some additional opportunities that form part of the Academy offer. Some of these may not be relevant for you, but I wanted to give you an overview of the breadth of opportunities that we do have available. Next slide, please. Since 2018, the NIHR has been working to break down barriers to career progression in research, but our portfolio of opportunity has grown over the years and has become quite complex. So we want to simplify how these are presented to ensure that opportunities are more accessible and easier to understand. We don't want to lose the focus on areas we have worked hard to promote, and rather we want to rationalize where there's commonality so that we can be more effective. So in 2025, our plan is to align awards from our NIHR fellowships, our NIHR integrated clinical and practitioner academic fellowships, and local authority academic fellowship programs by career stage. So these will be organized by pre-doctoral, doctoral, and postdoctoral levels, as you can see on this slide. So no funding opportunities will be lost, and there's no reduction in our investment. We will keep a focus on the audiences in areas where we've worked hard to promote, and we'll have committees at each level that are similar to our current committees and that will review applications based on applicants' background, setting, and area of research interest. So the benefits of simplifying our offer, so simplification, is improved communication about our offer of career development awards, including the language that we use to describe our awards. Opportunities will be easier to navigate and remove duplication. Committees that assess applications are arranged based on research area, professional context, and setting. So all further comms in relation to simplification will be published to our website. I'll drop a link into the chat box on recent communication from our Academy Dean. Next slide, please. Here are some quick pointers from us, so some key points to think about when you're putting together an application. Next slide, please. So it's really important to think about where you are in your career and where you'd like to be. So as I've shown you in previous slides, we've got a broad range of schemes. Our offer allows you to pursue academic career development to suit your career aspirations. Our offer is for a range of professional backgrounds. This includes doctors and dentists, healthcare professionals. And as you've seen in my previous slide on simplification, these will be organised by career stage going forward. So if you have no idea where you want to start, there are also opportunities that give you the time to think about your next step and the route you might like to take. We're more than happy to go through things in a bit more detail with you. So if you have any questions at all or would like some advice, please do get in touch with us. The Community Rehabilitation Research Network can also put you in touch with other researchers to help you on your journey. Next slide, please. So here are some tips on putting together an application, and these are based on feedback from our committees. So the remit of the proposal needs to be clear and must demonstrate how the research is important and benefits patients and the public. Research questions and aims and objectives need to be detailed and clear. The research being proposed needs to be achievable and suitable for the level of the award. The training program needs to be suited and specific to your needs and project and not just centered around the host organization. The application or proposal needs to demonstrate value for money. So the budget should be realistic and fully justified. And the PPIE plan must be strong, and you must ensure that it's budgeted correctly and embedded throughout the project. Next slide, please. That's it from me. Thank you for your time and attention. So here are some key messages from us. And once again, I'd like to add that we're more than happy to have a chat with you about any particular funding opportunity that you might be interested in or for general advice. So please don't hesitate to get in touch. Our email address is displayed here, and I will drop it into the chat as well. I'll hand back to Jackie now. Thank you.
Thank you very much to all our panel members for introducing the CRRN today. And thank you very much to Humera for unveiling the new streamlined funding award system at the NIHR. There is lots of really helpful information for everyone, no matter where you work or what level of research activity you plan to undertake. So we've now got time for Q&A. I know there are some questions in the Q&A. There's still time for you to send in more questions. So please do. You can post them anonymously if you don't want to have your name. And you can also click on some thumbs up icons to upvote them. I'm going to have a look at some of the questions we've come through. There's one about social care, which I wonder if Wilson could answer. How can I be supported from a social care background? Wilson.
Okay, thank you. So thank you for joining this webinar. I think what I'd like to start off by is just highlighting firstly that social workers and social care practitioners work in multidisciplinary teams with other professions. And the work that they do, they support a range of service users, children, adults, older people, focused on supporting them to be as independent as possible within their everyday lives. So if you just think about that in itself, it presents a lot of opportunities for social care practitioners to engage in research with others or research that is just purely within social care. But one of the key areas I think is really around integration of care and how we actually understand what integrated care means and how integrated care works when you're working with others. So that is something that social workers, social care practitioners would be keen on looking at. But also thinking about the actual nature of social care practice, it involves the interface between clinical and community practice. So working around that interface requires a lot of work around supporting implementation of care plans, being part of the review of those care plans, and that in itself, again, creates more opportunities around getting involved in research, which would be around the lived experiences of people who are accessing and receiving the services, participation in decision-making, and how to reduce costly and quite detailed interventions that sometimes might not be necessary, but also importantly, research around understanding the challenges and complexities of working in multidisciplinary teams. How might you be supported? Well, as you've heard from my colleagues, the CRRN will highlight opportunities where you might get supported. There's also support around helping you to build connections with others who are doing similar work. And there's also opportunities for us to signpost you to available resources that might be those that are specific to social work, or they might be generic. So I suppose in a nutshell, those are some of the opportunities that I foresee around anyone who's in social care and would want to connect with this network and the benefits that you might gain.
Lovely. Thank you so much, Wilson. I hope that's of value to people on the call. So in closing, I just want to say a big thank you again to our CRRN presenters. I hope everyone has found this webinar useful and that you'll join us for resources, connections, support, advice, communications and research opportunities, and lots more exciting plans are being developed for the future. We really are seeking people to create together a community of practice that works for everyone. We want to reach the underserved groups and communities that are not yet well represented in research. And really, we want to change the infrastructure and culture in our communities for the better by building research capability and capacity where it's most needed. Next slide, please. As you can see, these are our contact details. They're on the screen and they'll be in the recording. And I just want to say a final thank you to everyone for attending, and I hope you enjoy the rest of your day. Thank you for taking time out, and please do get in contact with us. Thank you.